So nearly 1 in 4 New Yorkers experience a mental health disorder in a given year, but not all of them know where to turn for help. The National Alliance on Mental Illness is a nonprofit organization with a network of resources and support programs for anyone struggling with their mental health. So here to tell us more about it are Janice Garfinkel, who serves on the board for the Queens Nassau NAMI affiliate, and peer facilitator Kimberly. Kimberly, could you pronounce your last name for me? Because I want to make sure we get it right.
Ukulele like ukulele.
Okay, Uckele. Well, great to have both of you here, ladies. Thanks so much for joining us. Janice, can we start with you? How did you get involved with NAMI?
Well, what happened was a family member of mine started exhibiting difficult behavior, and she was actually diagnosed with a mental illness. I had no idea. I didn't have any resources. I didn't have any people who I knew who have been experiencing this that I could go to. We just didn't know how to navigate the system. He ended up in the hospital. And what happened at the hospital, we saw this flyer about NAMI. And it says it gives support groups and it helps families. And right away, we went there and we asked them, what do they do? Well, they gave us resources we needed. They gave us the classes we
Wow,
needed.
that's great.
And they gave us the education we needed, not only for me as a family member and my husband, but also for my son who is
Yeah.
going through
Well,
this.
now you serve on the board. You also are a program coordinator. Can you tell us what some of the programs are that NAMI offers?
Yes, we offer all kinds of programs. We offer peer support programs. Peer support programs are run by peers, people who have experience with mental health conditions who are now in recovery and want to give back to their community. We also have a socialization group. A lot of times people come out of the hospital or they go through a break and they isolate themselves. They don't know where to go. Maybe their friends have moved on. So we have something where they can come into our community with people who have experienced the same things that they have
Yeah.
and meet people with similar experiences.
Yeah, well, you mentioned peer facilitators. That's Kimberly, right? And Kimberly, can you talk about how you came to NAMI actually seeking help?
Well, my parents went to see a psychiatrist when I ran away from home, and the psychiatrist recommended NAMI to them, and oh my, it's helped me so much. I used to be so lonely and depressed. I lost so many friends, and
Oh,
I joined the NAMI socialization group, which really helped me a lot because we didn't have a mental health condition. We were just human beings, like you didn't have to say anything like that, and
what's
there
one?
was time for us to talk about what's stressing us out, like how I'm afraid of driving because I have so much anxiety. Another girl there felt the same way, so it's really helpful.
Yeah, and now you actually lead support groups and classes. Can you tell us a little bit about the work that you do now?
So I run a peer-to-peer class. It's basically mental health recovery skills. My favorite part of it is we set SMART goals every week. So, it can make you get out of bed when you're feeling depressed. Like I will walk outside for 30 minutes, 5 days this week. Great. They're out of bed. They're doing something constructive. Or I'll cook dinner for my parents 3 days a week. That's excellent. You're out of bed again, working hard. So and we also have treatment options. So we'll tell you like the different medications and therapies. We do not endorse any because
Yeah,
we're not psychiatrists and stuff, but it's nice to let them know what's out there.
yeah, and
We got mindfulness activities. I mean, it's just really wonderful.
it's like you're also kind of like a cheerleader for them too. Janice, there's a lot of stigma though around mental health. What communities do you say, or do you think NAMI needs? What communities need NAMI's help the most?
Well, I think we all need NAMI's help, but I think we are starting a lot of programs for the Black and Brown communities, for different cultural communities. We're getting out there, we're talking about it. The most important thing is to talk about it. A lot of times people want to keep it inside, they don't want
Yeah.
to say anything. We have an Ending the Silence program where myself and a peer go to different high schools in Nassau County and Queens, and we talk about what to look for if a friend or yourself is experiencing something that you don't understand, or you're isolating yourself, or this has been going on for a while, what you can do to help yourself or what you can do to help your family.
Okay. Well, before we let you go, can you tell us about the event that's happening this weekend?
Absolutely. We are having a NAMI Queens Fest. It's going to be wonderful. We're going to have food. We're going to have music. We're going to celebrate ourselves. We're also going to have a lot of different resources available, whether it be something on psychosis. We have a housing resource. We have some attorneys who are coming to talk about how to navigate the system. And also, we have the track that's outside, and we're going to go for a 3K run slash
Oh, that's
walk.
great. And
Yeah, be a lot of fun.
And Kim, to end this off, can you just give us maybe a word of advice to somebody that might be struggling with mental health right now?
I would really recommend, if you can, going to the NAMI social station group. It's called NAMI Unites. Because I would have been lonely and depressed with no friends if I hadn't went there. Like when I got sick, I lost so many friends, and when I went there, they were so kind and welcoming. And also, too, you can attend a peer support group because you wouldn't have to speak. You could just sit there and relax and listen to other people. There's no pressure.
Yeah, well, the help is out there. Janice and Kim, thanks so much for joining us this morning. We appreciate your time.
Thank you so much for having us.
All right.